My name is Julie Sundermeier, and I am a neonatal nurse practitioner. I got my BSN here and my master's, and I am currently enrolled in the DNP program, and I hope to finish this summer. I liked the tradition of Creighton. It had a well-established nursing program when I started as an undergraduate, and I've returned for each degree because of tradition. I love the educational process here. It's very personal. I'm the lead nurse practitioner in the NICU at the Nebraska Medical Center. I've been there 10 years, and prior to that, I worked at Creighton University Medical Center. I started off taking care of adults, and I knew that that was not for me. So then I started taking care of pediatric patients and basically worked my way down to the smallest type of population, which is neonates. And I really love babies. I like premature babies. I like seeing them grow and make progress. I would recommend that young nurses get involved in legislation early in their career. As you get out there in the world, you can see more what's going on. You'll see that there is legislation that needs to be changed, that needs to be supported, or that needs to be opposed. The legislation had to do with the Nebraska Respiratory Act, and in that act, it states that respiratory care orders need to be signed by a physician. Nebraska looked at their statutes and found that indeed it was in there as well, and then it became enforced. And for me, this was unnecessary. It was duplication of services. In my practice, in the previous 10 years, I signed respiratory care orders, ordered respiratory care services frequently as intensive care nurse practitioner. So it is important legislation for the nurse practitioners of Nebraska. You need to be a voice, and you need to have a unified voice. So nurses need to join together to be one in front of legislators.